Without further ado, I will bring up the first slide, which is the first recommendation, which is for regulatory bodies to mandate cultural safety education for all individuals working across all areas of the maternity and neonatal workforce. Culturally safe care is an expectation. We've got Anna Adcock, who has joined us today. Anna is Ngāti Mutunga and has a master's degree in sociology from Te Herenga Waka, Victoria University, Wellington, where she's currently a researcher and doctoral student in Te Tai Hauora or Hine, the National Centre for Women's Health Research in Aotearoa. And Anna does kaupapa Māori, which is by Māori for Māori, sexual, reproductive and family health research that centres the lived experience and perspectives of whānau Māori, Māori family collectives. Her doctoral thesis includes a qualitative longitudinal research study exploring whānau Māori experiences of preterm birth. Anna is passionate about health equity, data sovereignty, research ethics, and whānau. Anna, thank you so much for joining us today. I'll hand over to you.
Oh, kia ora, Joe. Kia ora koutou katoa. Today, I'm going to be talking about what practicing culturally safe care is like according to health practitioners identified as champions by whānau of preterm Māori infants. That is, babies who are born early, between 24 and 26 weeks completed gestation. So, in a kaupapa Māori, that is, by Māori for Māori, qualitative longitudinal research study, we explored the experiences of whānau from across Aotearoa from the birth of their preterm pepe until their first birthday. And whānau is used here in a really broad sense, including parents, extended whānau, and key supporters. The study was guided by a kāhui kaumātua, a council of elders, and an expert advisory group of Māori mothers who had experienced preterm birth. Whānau were asked about their journeys, explanations they had been given, and system responsiveness, as well as how they were coping. And they were also asked about health practitioners that had championed their care. And that's what I'm talking about today. 10 champions were identified and agreed to an interview. They came from different backgrounds, professions, and hospitals. 2 identified as Māori, so the majority were non-Māori. They were asked about their role in caring for baby and whānau, explanations they gave to whānau, and thoughts about how the whānau were coping. In the analysis of the interviews, what was really interesting was the agreement between the champions about what their values and practices were that supported their working in culturally safe ways with whānau. Their narratives also aligned with what the whānau themselves had said about culturally safe care, which indicates that these champions were really in touch with the whānau that they cared for. I'm going to share the 3 themes from this analysis. The first theme relates to how the champions talked about working together with their teammates and wider colleagues, as well as with whānau in collaborative relationships. Being collegial meant they were better placed to be able to connect whānau to appropriate support when needed, sometimes problem solving or pivoting to ensure that they could deliver the best care for each whānau in each context. And this was always framed in a way that emphasized that whānau should be self-determining about what they want or need. Health practitioners said they need to listen to whānau and ensure whānau are confident to ask questions or challenge them rather than dictating care to them. The champions placed importance on developing rapport with, reassuring, comforting, and empowering whānau, A neonatal nurse said, "As much as we love the babies, it's not our baby." She was talking about the need to let parents parent. The next theme conveys how connectivity and relationships are critical social supports for parents and whānau in hospital. Not only were these seen as supporting emotional well-being, but also as positively impacting medical outcomes for the babies. Being consistent, a familiar face, helped create a sense of home. Caring for parents, letting them know that they were welcome and not alone, talking to them as people. These were presented as relieving some of the burden of hospitalization. Many champions also advocated for the important role of extended whānau, peer and social support services for parents. A senior medical officer said, "I understand the importance of whānau and how we need to involve them. And so I ask the parents, and if they want me to meet with them, then I'll meet with them. I'll give the choice to them." The final theme relates to how the champions acknowledged the special and sacred time that childbirth is, and the trauma that preterm birth causes for whānau as their anticipated birth journeys are disrupted. They appreciated their important role in supporting whānau to overcome challenges and spoke of love and feeling privileged to work with whānau. They understood the importance of whānau collectives for parents and babies in the hospital. They talked about wanting a future where the health services that they work in better accommodate whānau. And they described actions that they took in their day-to-day work to move towards these goals. A nurse talked about relaxing visiting restrictions for whānau if they wanted someone to come in and say a karakia, a prayer or incantation. And a counsellor talked about learning te reo Māori to better connect with whānau. And these are just a few examples. To summarise, today I've highlighted the role of predominantly non-Māori health practitioner champions and their ability to support whānau during their experience of neonatal intensive care. When the anticipated birth journeys of the whānau went off course, they were able to identify who were their key supports, their advocates, their champions. This is a key element of cultural safety, that patients define whether or not their care has been culturally safe. The champions echoed what the whānau said themselves, that culturally safe care is affirming, inclusive and loving, with health practitioner champions becoming like whānau. These champions did not need costly intensive care gear to practice cultural safety, showing that relationships are the safe care foundations, which in ever-stretched health settings are free. Good communication, sharing, showing love and holding space need to be viewed as part of evidence-based medical care. They provide the foundation for the systemic change and improved outcomes needed in Aotearoa. I'd like to end by acknowledging the beautiful whānau and champions who contributed to this research, and our Kahui Kaumātua and Rōpū Mama, the Mothers Advisory Group, who guided us. If you're interested in reading more about this, we published a paper earlier this year, and that's the title. Tēnā koutou, tēnā koutou, tēnā rā koutou katoa.
Kia ora, Anna. I was listening to that and I was just thinking so much of that resonated for me, and I know that it will have for almost everyone here. And I also like in one of your slides at the end how you kind of mentioned that scaling up systems change so that, the system is set up to better support people to be able to provide that care. So thank you.